If you're dealing with back pain related to scoliosis or hyperkyphosis, and you already have a pretty high level of core strength and stability, or if you're someone that's already completed our beginner and intermediary level scoliosis exercise routine, this could be for you. This is an advanced level core stability exercise routine program that I've specifically put together for people suffering from scoliosis or hyperkyphosis. My name is Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. Now, if you've been diagnosed with scoliosis or hyperkyphosis and you have not sought the help of a healthcare professional in person, I do encourage you to see a specialist in the non-surgical treatment of scoliosis or hyperkyphosis in person. And if you have scoliosis, be sure to click on our link below to download our free guide on treating adult scoliosis. Now, in this video, I put together a series of exercises, and these are more advanced exercises. So if you do not already have an established level of core strength and stability, I do encourage you to go back and begin with our beginner level or intermediary level core strength and stability exercise routine. But if you've completed those or you think you're in pretty decent shape, this could be for you. Now, these exercises are meant to be done in sequence. Total, it'll take you around 8 or 10 minutes to complete, and I recommend doing these about 3 times a week. And when done on a consistent basis, you can expect big gains in your core strength and stability, and likely a big reduction in chronic back pain related to scoliosis and hyperkyphosis. We're going to begin the advanced scoliosis core stability exercise routine by doing 3 warm-up exercises. The first warm-up exercise, you're going to lie on your back with your knees bent. Now, externally rotate one knee towards the ground, then return it back to center. Then externally rotate the opposite knee towards the ground, and then bring it back towards the center. Do this each side 10 times. The next warm-up exercise is the knee to chest exercise. You're going to lie on your back with your back flat and your knees bent. Gradually bring one knee towards your chest and then bring your leg back towards the ground. Then bring your opposite knee to your chest and then back to the ground. Do this each side 10 times. And the last warm-up exercise is the CARS, or Controlled Articular Rotation Spine exercise. You're going to be on your hands and your knees. Now gradually flex your pelvis forward and rotate each vertebrae one by one, starting with your pelvis, working your way all the way up to your cervical spine. Then you want to start to extend or flex your cervical spine with the chin downward, and gradually, vertebrae by vertebrae, flex each vertebrae all the way down back to your pelvis. Repeat this up and down 5 times. We'll then move into the bird dog exercise. So on your hands and knees, your knees bent, arms straight, you're going to gradually extend one arm and the opposite leg, and then bring that arm and leg back towards the ground. Then extend the opposite arm and leg. Repeat this 10 times each side. We'll then move into the advanced dead bug with straight legs exercise. Lie on your back with your arms and legs straight in the air. You're going to extend one arm and the opposite leg towards the ground, bring them back to the upright position, then extend the opposite arm and leg towards the ground. Repeat this 10 times each side. We'll then move into the static beast step back position. So you're going to be on your hands and your toes, slightly lifting your knees off the ground. You're going to extend one leg back, tap your toe, bringing that back to a 90-degree angle. Then extend the opposite leg back and tap your toe. Repeat this each side 10 to 15 times. Next, move directly into the plank position on your toes and your forearms. The goal is to keep a straight line between your shoulders, your hips, your knees, and your toes. You want to maintain this position for 60 seconds. You want to squeeze your abdominals, pulling your belly button back towards your spine. We'll then move into the side plank position with your arm rested on one forearm on your side and you rest your weight on your heels. You're going to maintain a straight line between your sternum, your pelvis, your knees, and your feet. You're going to hold this for 45 seconds. When you're done, flip to the other side. We're going to do a side plank position on the opposite side. Again, maintaining a straight line between your sternum, your pelvis, your knees, and your feet. We're going to hold this position for 45 seconds. return to the advanced dead bug exercise with both your legs and arms straight, extending one arm and one leg down towards the ground, returning it to the upright position, and then repeating with the opposite leg and arm. Repeat this 10 times each side. We'll then move into the hollow back position. You're going to lie on your back with your back flat on the ground. You're going to hold your legs up at an angle and your arms up at an angle, forming a V. We're going to hold this for 30 seconds. The entire time you're going to be sucking your belly button in, holding your lower back flat on the ground. We'll then do the hands, feet, plank, lateral tap position. You'll be on your hands and your toes, holding the plank position, and you're going to pick up one leg, move your leg laterally and tap your toe, then bring it back to the midline, then move your opposite leg laterally, tap your toe, and move it back to the midline. Do this for 30 to 45 seconds. And our final exercise, an advanced core stability exercise routine, is V-ups. You're going to have your legs straight and your arms straight. You're going to sit up, bringing your hands and your feet together in a V. Repeat this anywhere from 15 to 30 repetitions. I hope you found these exercises helpful. Now, if you're watching this and you're suffering from scoliosis or hyperkyphosis and you're not really sure what your next step is or what treatment options are available to you, click on the link below and request a free discovery call. And on that call, I'll be able to discuss your individual scoliosis or hyperkyphosis, your risk of curve progression, and most importantly, what your treatment options are. And for more information on the most effective treatments for scoliosis, be sure to click on our next video.